This is work that we presented at the AACR annual meeting, the second virtual summit. This work is about efforts that we've been conducting for the last year or more across many different departments at Moffitt to try and teach a computer how to read pathology reports. And the reason we want to do that is pretty much a lot of the information that you need to track and treat and follow response to therapy in cancer patients is contained in pathology reports. Very often when a patient comes into the cancer center, they'll get a biopsy taken, and a pathologist will look at that piece of tissue and come to a diagnosis and report on it. We have a team of people called a cancer registry who are specialists who learn how to abstract information out of pathology reports. And they do this for federal and state reporting requirements. But they only do it for the first encounter for new patients with new diagnoses. But this first encounter is enough to train a deep learning system. At least we believed it would be, and it turns out it looks like it is. So we believe that we're among the first to use this to try and teach a computer to understand pathology reports. Our initial goal was to have the computer identify where the tumor occurred in the body and what the particular type of tumor it was. And we got overall rates of success rates around 97% for determining what type of tumor it was, and around 93% for identifying the specific site in the body. And this wasn't just for a single cancer, this was for all solid tumors. And the ground truth was derived from the cancer registry folks. So using the ground truth, we taught the computer how to read and understand pathology reports. And now it can extract these two important pieces of data automatically, rapidly, and accurately. And our goal is to move on and have it extract other types of information that will be useful. So we're quite hopeful that this will have a big impact, a positive impact on the treatment and follow-up of patients here at Moffitt Cancer Center. Thank you.
I think that was great. It's a little bit long, but there's a few
Sure.
areas I think I'm comfortable editing.
Sure.
But I think we definitely have what we need.
Okay.
Just a follow-up question. So if we did any more of our blog stories in this area, where do you think that deep learning will go as far as, I know humans will never be replaced as far as reading, pathology reports and things like that, but is this sort of the future where we're headed, where, human error will essentially be eliminated by this sort of deep learning?
So the deep learning in particular, artificial intelligence is key to tackling the complexities of cancer. So it's going to get bigger and bigger and bigger as time goes on. And one of the main areas I see it is in what we call active learning or human in the loop learning, where a person does their ordinary job and behind the scenes, they're actually training a deep neural network to learn about what they do, not to replace them, but to eliminate all the highly repetitive, boring work that people are easily capable of doing. They just find it difficult, it's repetitive. And that's where a lot of the errors actually come up, is when somebody's asked to do something like identify a particular type of cell in a pathology slide, and there's 1,000 of them. Doing the same thing 1,000 times over and over again gets really boring. A machine doesn't care about that, and it's really good at doing that. So that's the goal here, is to have these systems learn from humans and take away all the boring, monotonous work to help make the job faster, more interesting, and so that people can focus on what they're good at, which is handling the unknowns and interpreting the data and making sure that it fits with the patient, that sort of thing. I agree. We're not going to replace people. What we're going to do is improve the quality of care and improve the throughput.
And so this report and probably others that are going on just like it, that's kind of the dipping your toes in the water kind of approach, or are you close?
Very, very much, because, well, so the underlying technology, this breakthrough technology, was only published about 1.5 years ago. So we're one of the first to report on using this technology for this purpose, the first that I know of. And we have an advantage at Moffitt because of the very good, strong cancer registry group that is very well trained and produces very high quality results, better than average, and the large patient volume that we have. So both of those are big factors for being able to train a deep neural network.
Perfect. I think I have everything I need, and it's great information. So appreciate your time.
Thanks very much.
Take care.
Thank you.